coming to the rescue, a new type of doctor. I'll be joining doctors in Cambridgeshire leading the way in emergency care.
They saved my life, and if they didn't act as fast as they did, then I wouldn't be here right now. So yeah, I am actually very grateful.
Dying of ignorance, why our young people are once again at risk from AIDS.
Things are really rising again. There's a lot more ignorance, and unless we do something about it, we're going to be back to where we were or even worse.
And tiny creatures no bigger than your thumb. We'll be revealing the very latest finds on Norfolk's Great Chalk Reef. Revealing the stories that matter closer to home. This is Inside Out for the East of England. Tonight, Inside Out is in East Runton in Norfolk. Hello and welcome to East Runton. Now, our ambulance crews are out there every day saving lives, but even their skills are limited. But now, thanks to pioneering work from doctors in Cambridge, even the most severely injured patients stand a better chance of survival. It's attracting interest from all over the world, and it's likely to be copied in other areas. We've been given exclusive access to find out how it works.
Okay, so get some more training.
All the time you get yourself distressed like that and cry, you tighten your tummy muscles, and that's what's going to make it sore.
The team in orange jumpsuits are a new generation of the emergency services, trained to deliver treatment usually only possible in a hospital A&E. Today, they've been called to a house in Cambridgeshire. Karen has a complicated knife injury in her tummy.
It's in a very precarious situation as to whether it has gone inside the abdomen or not. The chances of that going in deeper by moving her is much higher. That's why we have left her as she is. So we have managed to get some IV access into her, given her some advanced pain relief, so that she is as stable as she can. Because if her observations, as we have done, they are all fine at the moment. So we have got much more time to play with at the moment. You need to keep an eye on that.
Carrying Karen downstairs is too risky, so the fire service remove her from the bedroom. Usually, if you call an ambulance, you'll get a highly trained paramedic, but Dr. Monajit Chowdhury and paramedic Simon Standen are pre-hospital emergency specialists who can do even more than regular paramedics.
For the paramedics to give any strong painkillers beyond morphine would be quite difficult, so we gave her enhanced painkillers, things like fentanyl. But if she would have deteriorated from an airway point of view, we could have taken care of that. We could have intubated her, give her the anesthetic drugs, and keep her stable, keep her physiology stable until we reach the hospital.
Pre-hospital emergency medicine can help the most severely injured patients, and it is being pioneered here. This is the major trauma centre for the East of England at Adam Brooks A&E unit in Cambridge, and it's the best place to be in the region if you're badly injured. But there are some injuries that can be treated even before the patient has left the scene of their accident. 11-year-old Brandon Gravitt was hit by a bus, leaving him with life-threatening head injuries. The care he received at the roadside reduced brain damage and kept him alive.
They saved my life, and if they didn't act as fast as they did, then I wouldn't be here right now. So yeah, I am actually very grateful.
Basically, they said that they were going to put him to sleep, put him in a coma straight away, right at the side of the road. So we're not going to wait to get to hospital, we're going to do this right now. So we want to protect his brain function, and yeah, it's the safest option for him, and get the machine doing the breathing for him so that his brain has very little to do.
Do you believe, had it not been for the rapid response, that Brandon may not be here today?
Absolutely. Whether or not he would get through that really depended on the care that he got right then and there, and I think because they put him to sleep, he's still here.
A relatively small number of people will benefit from this treatment. It's about 700 a year, but for those who do need it, pre-hospital treatment could change their lives.
It's focused at people who are really, really sick. I often say whose needs exceed the capabilities of the normal NHS ambulance service responses. They're by definition a small, relatively small group of people, but they're really important.
The first training course of its kind has been set up in Cambridgeshire, training doctors and paramedics. It was started and funded by medical charity Magpas, working in partnership with the NHS. Rob Mackenzie is the clinical director of the Major Trauma Centre at Addenbrooke's and developed the scheme with Magpas.
I spent several years providing care as a volunteer doctor when I was free. And I started to question what was happening when we weren't there. What was happening? Could we do this better? Could we provide a more consistent level of care? And the only way to do that is to make pre-hospital emergency medicine part of the NHS response. So I started some work about 10 years ago now, nationally, to develop this area of clinical medicine as a specialist endeavour in its own right.
Magpas is supporting 5 trainees in the new specialism. Dr. Nick Foster is the first of the trainees.
I've always wanted to do pre-hospital emergency medicine, and when I started training as a doctor it was to do this. So I'm an emergency doctor. I have all sorts of skills at stabilising critically ill and injured patients.
You all right, mate?
My skills are best placed as early on in the disease process as possible. So you can make the biggest difference as early as you can get there. With regards to the public, with regards to the ambulance service, we are people in helicopters that fly in orange suits to get them out of trouble. What we're hoping to do is increase the numbers of doctors involved in enhanced care teams and pre-hospital care and provide a more uniform nationwide level of care.
Hello, it's Nick with the air ambulance. This is Phil. How can we help?
I'm one of the paramedics. I'm on my own here, but this guy...
Rob Major is a consultant from Addenbrooke's Hospital who supervises training at the Magpas Centre.
We spend a lot of time simulating unwell patients in our training. Now, Nick and Phil here are actually the duty team, but in a bit of downtime today between jobs, we're doing a training scenario. It's practicing and re-practicing and going through the process of putting someone to sleep at the roadside, which is probably one of our most risky practices in terms of what we do.
This sim man vomits, breathes, talks, has a heartbeat, you can collapse his lungs, you can put modules in him for surgical airways, some chest surgery procedures, he can have broken bones sticking out. This is as realistic as it gets. So much so that the first time I performed this procedure for real, on a real patient, it was only when I was at the putting the laryngoscope in his mouth that I thought, oh hang on, this is a real mouth. So it's very realistic.
Boozy out, thank you. So still 100.
East of England is the area of the country leading this in many respects in terms of we were the first people to get the first trainee in pre-hospital emergency medicine. You have to have specialist consultants training the doctors of tomorrow effectively, so that's our role, and that's why Cambridge has been so important in this whole process.
Okay guys, you can stop there. What we'll do is we'll do a quick debrief, we'll turn the simulator off.
And now this new specialism and training is being seen as a model for other regions, not just in England, but around the world.
Our colleagues in Australia are looking to now mirror the subspecialist area of practice or the subspecialty curriculum that we've put in place. So even in countries which have got arguably slightly more developed systems, people are looking at our experience and saying, what can we take from that and how can we apply it to our populations?
Now the course is being adopted nationally, Dr. Mackenzie believes it will improve emergency response in England.
I think the subspecialty will make a huge difference to pre-hospital care in this country over the next 10 years. Patients will be able to access consistently a very high level of pre-hospital critical care support.
Brandon is living proof that this treatment can save lives.
They say that the first 2 years are the crucial point in recovery. That's when the most recovery happens, the shortest amount of time. And he's doing very well. He's back at school now. He'd missed about a year's worth of school. He missed pretty much his entire first year. Yeah.
They used my case of scenario as an example to train up more people so that other people can save lives as well, which I thought was quite good. Of course, I was asked if it was okay with me, but yeah, I was fine with it, so yeah.
And if you want to get in touch with me about anything you think we should be doing a story about, you can send me a tweet at David_InsideOut or email david.whiteley@bbc.co.uk. You're watching Inside Out for the East of England. Still to come, the tiny creatures no bigger than your thumb, filmed on Norfolk's Great Chalk Reef. We've got the latest on the plans to protect them.
And this could be the largest area of marine chalk anywhere in Europe, one of the largest in the world. Even species unknown to science have been discovered here.
30 years ago, AIDS was killing thousands of people. But thanks to a hugely successful health campaign, thousands of lives were saved. But now it's feared those warnings are being forgotten. Well, Todd, who's from Cambridge, is determined not to let that happen. Joe Taylor went to meet him.
Frightening, devastating, panic, an epidemic that was just totally unforeseen. And here we are again.
In the 1980s, we were all aware of AIDS and the devastation it caused people, their families, and even communities. Back then, AIDS was the shocking killer. Celebrities Freddie Mercury, Rock Hudson, Arthur Ashe and Liberace all died. The government's Don't Die of Ignorance campaign was one of the most successful ever. But are we now at risk again?
Things are really rising again. There's a lot more ignorance, and unless we do something about it, we're going to be back to where we were or even worse.
Todd from Cambridge was diagnosed with HIV 4 years ago after being raped. He's now on a mission to raise awareness of HIV. He knows how the stigma of this illness stops people getting help.
It took me actually 2 years to finally seek support and help, both for the rape and being HIV positive.
So during those 2 years, you didn't tell anyone?
I didn't tell no one. It just left me devastated. I thought if I isolate myself and keep it within me, then no one would know what's happened, and I didn't have to be reminded of what happened.
HIV is now so much more treatable than it was 30 years ago, but once again it seems people still aren't seeking help through either ignorance or fear. Here in the East we have the highest rate of late diagnosis in the country. What that means is someone with HIV can have the virus for years without realising it, and that means it continues to spread. Todd supports others with HIV. Andrew, not his real name, waited 12 years before seeking medical help.
I couldn't wake up from the bed and walk to the toilet. It was so difficult for me, and I started getting slim, and maybe I think I went down to about 51 kgs, and that was terrible. That was really terrible. I really felt ill. And my mind, I never thought I would make it in life again, because I thought maybe that was the end of me.
He was so ashamed of having the illness, he didn't even try to get better.
With my kind of culture, it's like you've been cursed. You are not good in the society. You are just like a rotten fruit. So you have to be pushed aside. Even right now, to tell my mom, I can't even tell her. To tell my sister, I can't even tell my sisters that is what I am.
25 people in the region with HIV died in 2012. 1 in 5 with the virus don't know they have it.